You may have heard that diagnosing Lyme disease can be really complicated and the diagnosis is often missed. Join me today as I share 6 easy ways to effective Lyme disease diagnosis. Hi, I'm Dr. Tom Moorcroft and I am so excited to have you here with me today. I have spent the last 15 plus years treating patients with chronic Lyme disease, other chronic tick-borne infections, as well as a multitude of environmentally acquired illnesses. And I'm very excited to be sharing with you these 6 easy ways to effective Lyme diagnosis. One of them is to know what the top symptoms of Lyme disease are. When we think about Lyme, the top 3 symptoms, especially of acute Lyme disease, are things that are critical for you to know. So number 1 is the erythema chronicum migrans, or EM rash. This is a rash that's often referred to as a bullseye rash, right? So people are like, hey, you've got a little central clearing, you've got the red ring and clearing and red ring and red ring. So it's really important to note that that rash isn't always present in that classic kind of bullseye pattern. And in fact, most EM rashes are like a red expanding rash. Sometimes there's a little central clearing, but a lot of times they just show up as like a red blotch. So it's important because the rash is the most distinguishing sign of Lyme disease. But the thing is, it's not always present, but when it is, it's Lyme disease. Number 2 sign of Lyme disease is a constellation of symptoms that many of us heard as flu-like symptoms, or the summer flu, right? So soon after a tick bite, individuals can experience symptoms that are similar to the flu, such as fever, chills, body aches, fatigue, and even headaches. These symptoms are usually going to be starting about 3 to 30 days after a tick bite, with most people that I see in my practice developing symptoms about 2 to 4 weeks, or even a little longer after a tick bite, if they actually saw a tick bite at all. And then the number 3 symptom that we're looking at in our top 3 for Lyme disease is joint pain. Lyme disease can cause severe joint pain and even swelling, and that swelling is most commonly seen in one or sometimes both knees. One of the hallmarks of Lyme disease actually is that pain that can move around and affect different joints over time. So that migratory joint pain is one of that real important hallmarks that's going to differentiate Lyme disease from other medical conditions. So it's worth noting that while these are the most common early signs, Lyme disease symptoms can often become more diverse and severe as disease progresses, potentially impacting things like your nervous system, your heart or the cardiovascular system, and certainly many other parts of your body. So I'd recommend that you always consult with a knowledgeable healthcare practitioner if you suspect that you may have Lyme disease or one of the other infections you get from a tick. Number 2 on our list of the top 6 symptoms that are going to allow us to make an effective diagnosis of Lyme is a tick bite, right? So Lyme disease is transmitted to humans through the bite of an infected tick that's called the black-legged tick. There are specific ticks in the United States that can transmit Lyme disease. Number 1 is, and the most common, the Ixodes scapularis tick. It's also known as the deer tick or just the black-legged tick. It's found primarily in the northeastern part of the country and then the north central, but you can also see it in the Pacific coastal regions of the United States as well. And then one of the other ticks that can carry Lyme disease in the United States is called Ixodes pacificus. And this tick is commonly referred to as the western black-legged tick, and it's primarily found in the Pacific coast of the United States. So what happens is, essentially, if the tick is infected and then it happens to bite you and it feeds on you, it can transmit Lyme disease to you. So one of the questions I get so much about, transmission is, hey, I've heard that the tick needs to be on for more than 36 or 48 hours before it transmits. But this is sort of true, but sort of not true, right? So most of the time, the tick does need to bite and be attached to you for at least 24 hours to transmit Lyme disease or one of the other co-infections. But we know that transmission can happen faster. We've got cases of it happening with Lyme disease. There's another infection that is called the tick-borne co-infection, sometimes seen alongside of Lyme disease, called anaplasmosis. That's been documented to be transmitted in as little as 8 hours. So one of the important parts here is the transmission can be faster, especially if that tick is disturbed and not removed properly. So one of the important things to remember is don't be doing any of the spinning or putting stuff on it, we want to get some tweezers that are nice and needle point, get close to those mouth parts, and just lift up. And we don't twist or yank it out, we just wait. We just put a little tension and we wait for it to retract its mouth parts slowly. It could take 30, 60, even 90 or more seconds, and then it'll pop free. Then we need to go to the next step. Because what we know is the risk of Lyme disease transmission increases the longer that tick remains attached to you. It's always best to remove a tick as soon as it's discovered so that we reduce that risk of disease transmission. One of the things that we just talked about is just, you hear a lot about, oh, get everything out, including the mouth parts, right? Well, that's important. And the way to do that is to take that slow, steady approach that I just mentioned. Now, if you're bitten, you should really discuss the potential risks and as well as the benefits of tick bite prophylaxis with your healthcare practitioner. Because waiting for symptoms to develop is too late, right? Because that means that you're already infected. So if you'd like to learn more about that topic, check out in the description below. I've got a link to an article I wrote on our website that's called What You Need to Know About Getting Lyme Disease from a Tick Bite. Check out that description below, and I think that article will help you to know exactly what to do and how to have that conversation with your healthcare practitioner. We've covered the top 3 presenting symptoms of Lyme disease and then also tick bite in our top 6 ways to help us diagnose Lyme. So if we go back to number 1 there, we talked about this erythema chronicum migrans, or EM rash. So one of the things that I think is really important to do is take a little bit of a deeper dive. We know it's common. How common is it, and really what does it look like? So that erythema migrans rash really is the hallmark of Lyme. And so if you're in an area where Lyme is endemic, so meaning there's a lot of Lyme, like the northeastern United States or the north central area, and even now a lot of the western part of the country, we're starting to see more and more Lyme as there's habitat change and climate change. When you're in those areas where Lyme is super common, that erythema migrans rash is what we call in medicine pathognomonic, or it tells us that like essentially 100% you've got Lyme disease, right? But contrary to popular belief, only about 50% of individuals who have acute Lyme disease are actually going to develop this rash. So a lot of times I hear, oh, about 70 or 80% of people do. But the reality is, if you look across the medical literature, only about half of the individuals. And so the other thing is that many people envision this classic, that bullseye rash that I mentioned, right? But it's vital for you to understand and know that this distinct pattern of the bullseye rash only really represents about 30% of erythema migrans rashes. That EM rash could be as simple as a reddish blotch or even a ring with just central clearing. And in some cases, individuals can even develop multiple rashes, so you've got them kind of all over their body and in weird places. So being able to identify these variations is really key to that early detection and treatment. And the other thing we need to do is we really need to know the common symptoms that you're going to see with Lyme disease. Not only those top 3, but let's talk about some of the other ones, right? And within a month of that tick bite, Lyme can do the things we talked about: fatigue, fever, chills, and headaches. We can see those joint aches we talked about, but we can also get muscle aches and brain fog. And so remember that these symptoms can vary, and they're not all experienced by everyone, and they can kind of fluctuate and wax and wane, so they can come and go. So some of the other symptoms that you may want to keep in mind, particularly as Lyme disease advances and progresses from that early state, are things like an irregular heart rate, cognitive disturbance, or a lot of us call it brain fog. In kids, a lot of times we're going to see regression in school performance or emotional regression. We also could see a thing called a Bell's palsy or a facial palsy, where the lower part of one side of your face droops. And you could even have things like gastrointestinal disturbances. And while these symptoms are really not the most common early in Lyme, it's important to understand, like I said, as the disease progresses, we need to keep this in mind, because really, I mean, when you look at the rash, like we said, only about 50% of people remember having it. And in the research, it also shows that only about 50% of people remember getting bitten by a tick. And in our clinical practice, we actually see it's much less than that. So these symptoms are critical. And often the reason people come in with these later stage symptoms is They just didn't know to think about it in the beginning. Or maybe they thought they really had some sort of viral flu, right? It's totally understandable. Number 4 is two-tiered testing, right? And you may have heard this term before, but it's a screening test called an ELISA or an EIA or an IFA. They're all very similar antibody screens. And then if they're positive, it's recommended by most major medical organizations to then do a confirmatory Western blot. So if it's positive or indeterminate, we're going to move to this Western blot. And we're going to try to essentially confirm that our initial positive is actually accurate. So with that, essentially two-tiered test, again, antibody screen, if it's positive or equivocal, then do that confirmatory Western blot. And I think that's important to repeat just because so many people talk about this two-tiered testing approach and they have to understand what it really means, right? Lyme disease is a clinical diagnosis that we support with lab data, and there are notable pitfalls to this approach. One of those pitfalls is that timing is crucial. These tests are going to detect antibodies to Lyme disease in your body. So if we do the test too early, before enough antibodies have formed, you could actually get a false negative result. And then we also have, concerns over the sensitivity. Sensitivity is essentially saying that if are you actually going to pick up a true positive? And research has shown that this two-tiered approach really only has a sensitivity of 56%. So in simpler terms, it misses about 44% of true positive cases. And so this means for every 200 people with Lyme disease, this testing method can actually miss 88 of them. So almost a full 50% of people who truly have Lyme can be missed with that testing strategy. And one of the other reasons for that is there's natural fluctuations of antibodies. So over time, antibody levels can vary. And, so if this test was performed too early, like I said a moment ago, we could run into a false negative. The other thing is that over time in an untreated individual, as well as someone who's received some treatment, antibody levels do this, up and down, right? And so if the test is performed longer after the infection, there's another potential risk for a false negative. Many doctors are actually concerned about false positives, meaning you've got that positive test result. Oh, is it really Lyme or did it, trigger something that we reacted to some other infection in the environment? The thing is, I don't even really know where this all comes from because all the medical research that I've seen out there suggests that the real issue is missing the diagnosis altogether, right? And that basically means we have a higher chance of false negatives. And so that's really what we see with a lot of this testing strategy is it's so dependent on what test you do, when you do it, and is it too early or is it too late? So it's essential for medical practitioners and patients to understand and be aware of these limitations, when relying on these tests. Our number 5 in our list here of the ways to make a proper, effective Lyme disease diagnosis is that Lyme disease is a clinical diagnosis that is supported by lab data. So really the clinical takes precedence, like most of medicine, right? And we support what we're doing with our labs because we know they're fundamentally flawed. And that's okay, right? Because Lyme disease suppresses one's immune system and it can do it relatively quickly, and we're relying on antibodies to help us. But again, they should be relied on to help and support us, not to be the only diagnostic indicator. So Lyme is fundamentally a clinical diagnosis, and we're relying on those symptoms as well as our physical findings, and then we're using those labs to support our diagnosis, but our labs are not defining the diagnosis. To illustrate this, I want to share a story that so many people I've talked to and have heard and seen in different groups as well as in my practice, and this is a story that many people face, right? So they develop a rash, which is a distinct symptom or sign of Lyme disease. They're immediately diagnosed with Lyme, they get a blood test in the doctor's office, and then they immediately start on antibiotic treatments. But then soon after, maybe within a couple of days, they get an ELISA test and it comes back negative. So that antibody test is negative. And then the patient is advised to stop the antibiotic, right? Because despite having the rash, the test was negative. So, it couldn't have been Lyme disease. So then fast forward a few weeks, maybe a few months, and these patients are grappling with lingering symptoms that are consistent with Lyme. They go to their doctor and they're told that they have a condition like fibromyalgia or something like that, right? Like acute fibromyalgia, it's not even a thing, but they're misdiagnosed with it because we kind of forget that, oh, we started the Lyme treatment, or we even may have missed the diagnosis, and that's why they're presenting with these symptoms, because we didn't treat them appropriately. So I think that it's really, really important to understand misdiagnosis when we stop the treatment too early, because we rely on testing rather than our clinical judgment kind of can get us going down the wrong path. And then after all of that, with that misdiagnosis, patients are going to come to practitioners like me. And then through a comprehensive evaluation that involves a detailed history, a thorough examination, and supportive laboratory testing, we often determine that the true culprit is actually Lyme disease still. Right? And even in my own personal journey, I got 10 days of treatment for an accurate diagnosis of Lyme, and then 8 years later, I've got all of these symptoms, and someone finally ran a test, and they found out that not only did I have Lyme, but I had a co-infection that had been floating around for 8 years because someone didn't treat me long enough when my symptoms persisted. So with those right treatments, these patients who were initially misdiagnosed can find relief and healing. And so for me, this really underscores a critical message. Early accurate diagnosis is crucial, and early treatment is vital. So it's not just about reading the labs, but it's about listening to and understanding your patient. So the importance of time really can't be overstated. Recognizing Lyme disease early and initiating that prompt treatment is really pivotal to preventing the progression to persistent Lyme disease. So if Lyme disease is caught and addressed correctly from the onset, many people can avoid prolonged suffering and reclaim their health much faster. And always, 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 Lyme is about the person, not the test results. So when we kind of wrap this together, right, with our top 6 easy, effective ways to help make a Lyme diagnosis, number 6 is the Horowitz Multiple Systemic Infectious Disease Syndrome, or MSIDS questionnaire. If we want to just go, hey, maybe we missed the early acute Lyme disease, how do we really diagnose this, right? Because Dr. Tom, you're saying, hey, this is a clinical diagnosis supported by lab data. So how do we figure this out, right? So as Lyme disease really spreads globally and it mimics so many other illnesses, proper screening tools are really paramount. And this is where I would say enter stage right, the Horowitz MSIDS questionnaire. And so Dr. Horowitz, a great friend and mentor of mine, designed this powerful tool that was evaluated in not 1, not 2, but 3 separate medical studies to determine its accuracy in distinguishing Lyme patients from healthy patients, and Lyme patients from other people who are having non-Lyme things, right? So what were the findings? Consistently, the HMQ, which is the Horowitz MSIDS questionnaire, proved to be effective in this task of kind of pulling out Lyme versus others. And one of the most important take-home messages out of this is there are really 3 main kind of migratory pain symptoms that people experience that can really point more towards Lyme than many other things. And it narrows it down. So those 3 things are persistent muscular pain, persistent arthritic pain, and persistent nerve pain, or what we would call medicine paresthesias. These are strongly identified those people that had confirmed Lyme disease. So the HMQ stands as a valid, efficient, and cost-effective tool. So much of what we do is, I was trained, hey, these are the 4 symptoms, the 5 symptoms of Lyme, and really it's only those top 3. And if you don't have a red hot swollen knee, and you don't have an erythema migrans rash, and you don't have a positive test, it's probably not Lyme. Yet we have an epidemic of people who have Lyme-like symptoms who are getting diagnosed with all kinds of things. And when you really look deeper, they actually have active Lyme disease. A lot of the other ask them questions that are like the disease hasn't really been validated in Lyme. It's just all we had. But now we have a questionnaire that's been validated and super efficient. So medical practitioners can use the HMQ to determine if more specific tests are needed to diagnose and distinguish Lyme disease from any other conditions. There you have it. Those 6 most effective ways to diagnose acute Lyme disease. So thank you for joining our health journey today. And if you're keen on diving deeper in the insights of Lyme disease, understanding other tick-borne infections, and navigating through environmentally acquired illnesses, let's stay connected. Please hit the like button, subscribe, and even activate those bell notifications. It's a zero cost investment in your health, and your support is completely invaluable to my mission, and I want to say thank you so much. So I really look forward to staying connected and continuing our journey together, and look forward to seeing you in the next video.